All right, thank you, ladies. We're going to talk open enrollment. That's right, insurance, and that's why we have Gabriella Benitez here from Enrollment USA. You're here to help people understand and work their way through what is really a complicated system now.
Exactly. Yeah. Help with the confusion.
Well, yeah, and it's gotten so crazy. It was always crazy and always frustrating,
yes.
But then Obamacare came into the mix, and that really confused a lot of people, and that's what you guys do. You help navigate people through the confusion.
Exactly. So we help individuals with the Obamacare application to see if they qualify for subsidies, make it more affordable for them, and then we also do it individually in the private health insurance marketplace.
A lot of people are gypping themselves, I believe, out of good coverage and maybe spending too much money for poor coverage. And again, that's where Enrollment USA can help. How do you actually help people navigate?
So we help individuals validate or enroll for coverage. We have a comparison tool that helps us find the best health insurance options for the individual based on their specific needs, prescriptions, doctors, and then it just kind of displays different carriers and plan deductibles.
Now, what about our aging population, our 65 plus, who are going to be looking at different types of Medicare, Medicaid, the prescription meds? That's so confusing for people, and they can come to you and you guys can actually help them decide, as you say, what they need.
Exactly, and we're not doing Medicare as of yet. We will be doing that next year,
okay.
But that's exactly what we do for the general public.
Okay,
so,
very good.
yes.
We should point out that your service is free, which is a great thing. And how did you guys come about the concept, getting the Enrollment USA together and initiating it?
Right. Well, we have over 55 years of experience in the healthcare industry, and we decided to do it in Utah just because we feel like there is a lot of confusion and in every state. But here we have over 75 agents ready to take phone calls and help individuals find affordable health plan options. We also have a division called Familia USA, which is our Spanish division for individuals that need assistance in Spanish too.
Now, being that this is free, I'm sure a lot of people are watching now going, hey, I want to do this. I want to get a hold of these folks. What's the best way they can do that?
Right. They can actually contact us. They can call our phone number, 888-861-0186, or they can also go online at enrollmentusa.com.
Okay. What are some of the biggest mistakes people make when they're buying insurance?
When they're buying insurance, basically they assume that they know what plan they want without actually knowing the details. So perhaps they don't understand what a deductible is or the provider network. And those two are very important just because that will determine if you're going to be into a good coverage or not. So we help with that.
I'm always confused about the deductible when I have to enroll. How do you steer people into the proper deductible for them? Because I know some people have ongoing health problems and they may have to have a smaller deductible because they're going to spend that much money more often.
Exactly.
So how do you decide how much of a deductible somebody should have?
Right. Well, we have a comparison tool that helps us put in their information, how their health is it low, is it pretty high? So then we put that information in there and then we make recommendations and then they get to decide what plan they want. But definitely if you're a high utilizer, then you want to go with maybe a lower deductible, but that's going to be a little bit higher in premium, so we have to kind of make that calculation and for them. So.
All right. Well, Enrollment USA obviously can help all of us decide what kind of health plan we want, what kind of deductible we want, what kind of coverage do we want, dental, do we want vision.
Yes.
You'll walk everybody through all of those steps and make sure they get the right plan.
Exactly. And don't forget that open enrollment already started November 1st, and if people want coverage for January 1, then they need to enroll before the 15th of December.
All right. Gabriella Benitez from Enrollment USA, thanks very much. It is free. Give them a call if you're confused about your health insurance open enrollment this year. All right, we're going to take a break and we'll head back to the kitchen in just a few minutes.